Welcome to video 4, where we will show you some exercises to help your pain and spinal mobility. Hopefully these exercises, together with advice from video 3, will get you back to doing the things you enjoy. Start off lying on your back. The best place to do this would be on a firm surface such as the floor, but right now it may be too difficult to get onto the floor, so perform where you can, maybe the bed or sofa. If you prefer, you can perform some in sitting or even standing. You need to perform the exercises where you're most comfortable. Your knees need to be bent and your feet on the floor. This is what we call crook lying. Place your arms out to the side for stability. Slowly lower your legs to one side until you feel a gentle stretch on the opposite side. Return to the central position and repeat to the other side. Keep your knees together during the movement, but do not fix. Aim to perform this for 30 seconds to a minute, and you can build up to this as able. Your starting position will be the same as for knee rolling, but you can quite easily do this in sitting. This time you will raise one knee towards your chest as far as you can with the help of your hands, and then raise the other to meet it. Place your hands around your knees and pull them gently towards you until you feel a stretch in your back. If this is too much to start with, you could just do one leg at a time. Aim to perform this for 30 seconds to 1 minute as you can tolerate, and you can build up the time as you are able, and that is okay. Again, you will start in crook lying. Your feet and knees need to be in line with your hips and your arms resting by your side. Start by tilting your pelvis backwards so your lower back pushes into the bed. Perform this movement nice and slow and be in control. Try not to brace and don't hold your breath. To progress to a bridge, push through your heels and squeeze your buttocks to lift your bum up off the bed. You're aiming for a straight line from your thighs to your torso, but this may be too difficult initially, so perform the movement as best as you can and build up the height as able. Slowly lower with control and ensure those knees don't move or wobble. You want to aim to perform this exercise for 8 to 10 repetitions, little and often throughout the day, but you may have to build up to this as able, and again, that is okay. Yes, the starting position is the same. Start by bringing one leg towards your chest with your hand. It doesn't need to be pulled all the way up. Gently straighten your leg by lifting your foot towards the ceiling until a light stretch is felt whilst keeping your buttocks on the floor. Hold for a second or two and slowly return to the initial position. Repeat for 30 seconds. You can then repeat this on the opposite side. You could also do this in sitting by extending your leg out in front of you, or even in standing by placing a foot on a step or stool and leaning forward. It's up to you to find which position suits you best. This time you need to turn over so that you kneel on all fours. Place your hands and knees shoulder width apart. Hips should be at 90 degrees and your lower back should be at neutral with a slight curve. Slowly move your hips backwards to get your buttocks to your heels, maintaining a straight back position. Allow your head to relax downwards. Hold the stretch position for 30 seconds as able and repeat up to 3 times. Or if this is too much to start, hold for as long as comfortable. Start in the same position as a child pose, on all fours. Reach your right arm under your torso towards the left, bending the left elbow to bring your shoulder and head to the mat. Gently rest your head on the mat or floor. Stay in this position and breathe for 3 to 5 breath cycles. You can then repeat this on the other side for the same number of breath cycles or as you feel comfortable. Find a comfortable chair to do this exercise from. Make sure your knees and feet are pointing forwards, hip width apart. You can have your hands across your chest or held out in front of you. If you're unable to do this without using your hands, you may want to start from something a little higher or place some cushions on the chair to raise yourself up. Lean forwards and using your legs, push up into a stand. To sit, stick your bum outwards, bend in the middle and lower yourself back to the chair with control. Try not to fall back into the chair as your muscles will be less active. Aim to do as many as you're able and build this up slowly. The exercises you've seen in this video are to help in early stages, to support mobility and a little buttock activation. You should notice a difference after 2 to 4 weeks of performing them. If you are ready to progress, you can start moving your lumbar spine into weight-bearing positions such as sitting and standing. You can also add in functional movements such as bending, squatting, twisting, and make these movements specific to your daily movements at work and home. Just remember to start off slow and pace your recovery. Good luck, and remember our spines are strong, stable structures.